kind of try and do it as a diagnosis of elimination. So I firstly want to eliminate any of the serious pathologies that can occur around the sesamoids. And so that would be like a stress fracture would be the main one. There'd be like either an acute fracture where normally you have more suspicion because the history is like a high impact sort of thing with acute pain and swelling. But you can get these more insidious onset chronic type stress fractures that you need to differentiate from just the other causes of pain there. So I'd be going through the history like with any injury, like you get all the clues from the history, and then the physical exam to try and sort of determine, how sensitive it is on direct palpation on the actual sesamoid, and just some other clinical tests that you might do to differentiate. But if I have any suspicion of bone involvement, I'll likely refer for X-rays and MR just to rule it out, basically. Then once it's ruled out, I'd be more happy to treat more conservatively and like one of the other conditions, which like I think most commonly when I think of sesamoiditis, I think of joint pain. So I just think about the little sesamoid running through the groove in the plantar aspect of the first metatarsal head. And often I think there's pain associated with that joint. So again, it's similar to patellofemoral pain in the knee joint. So there's just sort of like the contact pressure. The difference being though with the sesamoid, it's unique in the fact that it's also hugely weight bearing. The compressive loads are high as well as the tensile loads. That's why it is a tricky condition, because it is, it's on the foot and there's a lot of load that can go through them. So once they are irritated, we may need to be quite aggressive with offloading them to let, or changing the position of the joint to sort of alter the contact forces around the sesamoid and the first metatarsal head. There's obviously other conditions, like one I've seen a couple of times recently is the bipartite sesamoid. So it's just the sesamoid as it ossifies in kids, the growth centers, occasionally instead of just becoming one bone, it becomes two and occasionally three pieces of bone. And to need to differentiate that between just an anatomical variant versus a stress fracture, which you can normally do from the history and the X-ray. But that can be really tricky because the bipartite sesamoid will have this fibrous connection, and sometimes that fibrous connection can get symptomatic and disrupted. And so it is a little bit like a stress fracture in that these two halves that were once connected by this fibrocartilage kind of inflamed and irritated and need to be settled. And I think of it again a bit like another analogy for another injury I see a lot of is the navicular syndrome. So that's where there's like the type 2 navicular syndrome is like where there's the accessory bone. So that the medial side of the navicular has an accessory, and it's not attached to the main body by bone. It's the fibrocartilage again, and so people with navicular syndrome are more likely to develop that if they have that fibrocartilage connection with their accessory navicular. And so I think people with bipartite sesamoid, they might be possibly more inclined to having that pain there due to the anatomy. Hi, my name's Tom DeCanto. I'm a sports podiatrist and an elite distance runner. And today we're going to be talking about a tricky condition, sesamoiditis, and you're listening on the Physical Performance Show.